The current situation with edibles in the industry is kind of dire. It's all over the place. I'm Rev.Doctor Kymron deCesare. I'm Chief Research Officer at Steep Hill. 2 years ago, the USDA had to test a bunch of CBD products. Some of them had nothing in it. Some of them had heavy metals in it. Some of them that claimed to have 100 milligrams only had 27. That was, legitimate companies, cannabis companies that had been around a while that were doing this. So what we need is compounders who want to do the right thing because they're putting the patient first. When edibles by E came up, we had a very long conversation in our first consult. First off, THCa is what's in the plant. If you extracted that without adding any heat, you get massive amounts of it out of there. We've been eating THCa for thousands of years because every time we eat cannabis plant, we're eating THCa primarily. That is the main cannabinoid that's there. I know that Delta-9 has gotten popular for getting rid of nausea from chemotherapy. THCa works much better, and it has a duration of up to 8 hours, not just 3 or 4 hours. So you eat it orally, and it has that effect. Also, THCa helps to work against insomnia by working to lower dopamine levels and things in the brain in a way that allow us to sleep better. So we're noticing, it doesn't make you drowsy, but if you have a lot of mental confusion going on in your brain that's making it hard to relax and go to sleep, we're finding that these lesser medical properties like the anti-insomnial effect are important. And moving forward, we're finding out that that's what people are going to do, because it helps with a lot more illnesses than even Delta-9 THC does. Especially it helps with an aging market. Anybody age 35 or older that's played in sports and have banged up joints, it's going to help. Anybody with arthritis, it's going to help. It's a replacement for steroids. Turns out these immune modulators work so well, they're not only good for replacing steroids, but it turns out that a lot of people that are on antihistamines can either back off of the amount they use or stop using them completely. Edibles by E, I'm very confident, doesn't have any of the impurities in them they're not supposed to have. And if you looked at every component that was in there, whether it was THCa or a particular terpene, and you ask her, why is that in there and why in that amount, there's going to be very specific reasoning that went into thinking about what happened there. So this begins to be the sort of medication that we want to see coming on the industry that would be more reminiscent of 10 years from now, 5 years from now, if somebody walked into Walmart, what they could get at the counter at a pharmacy, right? So we have to have all the dangers gone that come from contamination. We have to have everything properly compounded right? And there are not a lot of people doing that. Then I understood that this is a student that I wanted to teach, putting the patient first, and realize that they're making a commitment that every 6 months, they're going to improve the quality of their medication. And it takes a lot of extra work, and it does cost more. You don't get the irrational, huge profits that you do when you're cutting corners on all this. So a lot of it's here in heart, and realizing that you're dealing with patients and you're taking that person's life into your hands, okay? Edibles by E are willing to make that commitment to do it right.